A Day in My Backyard by Jamie Bergstrom. The clinic at a glance. This is where I work every day after school and every day in the summer. It's called Lindsborg Veterinary and Animal Hospital. That's the K-State purple front door that distinguishes us from the rest. The entire building is made of concrete, and the first owner built it to be a vet clinic, so it's already got everything that it needs. There's a garage, as you can see, and then on the other side of the building is a corral and chutes so you can work cows and horses back there, and he also has a little stable back there that you can put your cows or horses if they're deathly ill and they need to stay overnight. Inside the garage he has a cow chute so that he can work the cows in the winter and he's not freezing to death. We keep the dog food and cow medication in the garage as well. You will meet everybody that works at the clinic, such as Liz Kibler. She's a vet tech / secretary. I help her out a lot. Jen Kibler, who is the same thing as Liz. She's a vet tech and a secretary. Dr. Byron Bachman, he's the current doctor at the clinic right now. His wife comes in sometimes. And of course, all of the animals. That is Morris. Not sure what that cat's name is, but she was there to get checked out. And of course, the cute little puppy dogs that we all love. Here's what I do on a daily basis. I fill prescriptions, such as what Liz is doing. I also do pills and wormers and shots. I clean, feed, and take care of the animals. These are the indoor kennels, and I clean the outdoor kennels as well with the hose and pooper scooper that we have. I help hold the animals for the doctor when he's either giving them shots or checking them out to make sure everything is physically okay. I help give the shots and shave the animals before surgery as well. Byron is currently trying to give a shot to a cat so that it will fall asleep so that we can do surgery on it. Was not a very happy kitty. Once we have the cat shaved, like in the video here, we tie it down to the table so that it can't move around during surgery if it wakes up. And we get the surgery equipment ready. We spray the cat with iodine after we've cleaned it with chlorhexide scrub and alcohol. And if it's a dog, we'll put the oxygen mask on it to keep it from dying. Cats don't need it because we don't give them enough medicine to make them go under for very long because it doesn't take as long to spay or neuter a cat. Jen is opening the towels, and you're not allowed to touch any of it because it's all sterilized. So we can just touch the blue packaging around the towels, and Byron uses the towels to soak up any excess blood that there might be during the surgery and to just keep the surgery area really clean and sterile. During surgery, we watch the breathing rate and help the animals breathe if they can't do it themselves. There was a dog in the clinic that day that couldn't, so every 10 seconds we'd have to give the little chest a push so that she would breathe. He is currently spaying the cat that was on the table. We also go on farm calls, such as horses that are down or people who can't bring their animals in, or prolapsed cows like this one. The cow had a baby and her uterus came out along with her bladder, and we were trying to get her up and get her into a chute so that we could put everything back inside. There's the baby calf. He was so cute. Byron here is pulling off the excess placenta. He thinks that's the cause of why it came out, is because all of this was so attached to the uterus. And once he has it pretty much cleaned off, he'll dump chlorhexide scrub over it to kind of help sterilize it, so maybe she won't get an infection when we put all of this back in. 25% of all prolapsed cows will die. Byron believes this is because they ripped an ovarian artery, and once you put their uterus back in, the pressure is released off of that artery and they bleed to death from the inside, and there's not much you can do to stop that. Here he is shoving the uterus back into the cow, and this can take either a short time or it can take an hour or more. The farmer here is helping Byron because everything kept slipping and falling and he couldn't get it all put back in as fast as he would have liked. The cow was given an epidural so that she could not feel any of this, and she was just standing there in the chute. She was going into shock because of the blood loss that she had. So Byron will give her shots for that when we get done putting everything back in. Byron is sewing the cow up now so that hopefully it prevents anything from coming back out. If she tries to push it all back out, this will hopefully keep it from coming out. The cow is starting to lay down on him because she's tired and lost a lot of blood and just exhausted from the entire process. And after he gets the stitches in, we will open the gate and attempt to get her out of there, but in this case she died because she just lost too much blood and went into shock. We also do routine checkups on cats and dogs and horses and cows. They bring them in and Byron just checks all their vital signs and then looks at what the owner might think is a problem, and then he hands out prescriptions and does a lot of that. Here he is just making sure that the dog is okay and physically healthy, and to make sure that there's not any underlying problems that he might have missed in an earlier checkup. And he's also going to give the dog vaccines, and he always makes sure before he gives vaccines that there aren't any underlying problems that he needs to know about. Rabies go in the right shoulder and distemper goes in the left. Same way on a cat, only we do it in their rear end. Here Byron is doing preg checks on cows, and the owner did not want his cows to be pregnant, so if they were, Byron gives them a shot, and the shot will cause them to have an abortion unless the cow is too far along, and then it probably wouldn't do anything at all. We close up every day also, and I want to thank you for watching my documentary. And Liz is getting a client out the door as fast as she can here.